It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day, everyone. I don't care if it's day or night you're watching the show. I do care. I just want to say greetings to everyone, and thank you so much for tuning in today to another wonderful episode of NuWellness TV with Dr. Lee. I just want to say that I am so excited. I have a wonderful guest with me today, as always. I'm just meeting her and her beautiful mom, which is in the studio. You won't see her, but she's here. I just want to say that she's going to be sharing some information with us that is really, after me last night being in the hospital with a dear friend who just had a stroke, this is life-threatening. This is life-threatening information. And I want to ask a question before I start. And also, I want you to grab a pen and paper. Pen and paper, because you're going to need to take notes. Because you never know who or a family member or someone else, you might need to know these techniques to really see what's going on. So have you or anyone you know ever sustained brain trauma? Car accident, a fall as a child. You know, sometimes we bump our head. I had a new car and it was kind of aerodynamic, and every time I would get in, I wasn't used to it being so low, so I would bump my head, which I really think I had a couple of contusions from that. You don't have to lose consciousness to have a concussion. Okay, to have a concussion, you don't have to lose consciousness. What is all this doing to the brain? So this is what my guest is going to be talking about today. Dr. Danny, I want to thank you so much for being here.
Thank you. Thank you. I'm excited.
They're all cheering us on. Isn't that wonderful? How wonderful. Thank you, audience. Thank you. Okay, so, let's just jump right in. Your bio went out. We sent out an email. So we sent out your bio to everyone.
Okay.
But we're going to be talking about, the brain and what's happening and how to test these wonderful techniques that you were telling me about when it comes to look quickly for brain trauma.
Right.
Whether it's the right or left side of the brain or if it's true trauma. So we're going to be sharing that. And I want, like I said again, please have a pen and paper to take notes because this is important. And we all have bumped our head on a cabinet or, just simple things and not knowing down the line, why do I have this type of symptom? And it was basically from head trauma.
Right.
And, you asked that as one of your questions, but that's something because I worked in the emergency room and used to ask a lot of questions. So that was part of the questioning I would always ask. Trauma is always the number one question. What type of trauma that led you into this? So before we start, tell me about you.
Okay.
Please.
My name is Dr. Danielle Olson, and I'm originally from Minnesota. I now work in Santa Monica. And we met several weeks ago. I'm a chiropractor, and I specialize in a form of healthcare called craniopathy, which is what we got talking about at a meeting one time about how important it is to take care of the skull. And a lot of people don't realize that we have...
before we get into that, I know you're moving kind of fast.
Yeah.
But tell me who you are. I mean, you're here from where? You just moved to California.
Oh, I just moved here from Minnesota.
From Minnesota?
Yeah.
Okay, so just tell me about you and...
I think,
why did you go into this field?
I think one of the, I will tell you that. One of the reasons why I'm here is I've had a very magical life. I developed a brain tumor when I was 31 years old. I was nearly blind, and knowing neurology like I do, I realized all the symptoms I had, it was behind my optic nerves, and I had a very, very small amount of vision left. Enough where I could see about the size of a quarter.
Okay.
Which made driving very difficult. And
how old were you?
I was 31.
31. Oh, that was very young.
Yes.
Very young.
And part of where it was located affected my pituitary gland, so I could not have another baby, and I really wanted another baby. And being trained in complementary medicine like we are, I decided to do natural approach to it. It wasn't a malignant tumor, so I'm not crazy. But I started listening to things that were happening around me, people that were being introduced to me. and I met a craniosacral therapist.
Yes.
And in chiropractic school, we're trained in anatomy and physiology, and we look at the body as a whole, the chemical, physical, spiritual, emotional being.
Yes, yes.
And craniopathy, which is my specialty, is something a lot of doctors don't know about.
No, they don't.
So I went to this craniosacral therapist, and I saw her 2 times, and I realized she did something with the head. I had something in my head, and I wanted to get rid of it. Mm-hmm. And during our second course, as I was driving to her office, I was terrified because it was winter in Minnesota.
Okay.
And the whole time I was driving there, I just kept saying, today's the day this is going to be healed. I know it can be healed.
Yes.
The body is
the
able
mind
to be
is so powerful, too.
Absolutely.
But you setting that intent.
Setting that intent the whole time,
yes.
whole time. And you and I have talked about this, the power of the mind.
Yes.
And as I was laying there, I had some very interesting experiences. Met an angel, had some conversation with the angel, asked what if I was doing the right thing. And they told me you need to look within, which I thought was interesting because, I love working with the brain. And I was like, well, look within, what does that mean? During the course of our session, this angel brought my father to me, and he had passed away 4.5 years earlier. Mm-hmm. And I had a conversation with him and apologized for not seeing him before he died. And as soon as I said that, I realized, oh my gosh, I didn't see you before you died. The tumor manifested right behind my optic nerves.
Yes.
And we had talked about this in my doctorate about how important it is to acknowledge when things have bothered us. Mm-hmm. And I never realized I didn't forgive myself for that. And as soon as I realized, I said, oh my gosh, Dad.
The power of forgiveness.
I manifested this, didn't I? Mm-hmm. And as soon as I said it out loud, something penetrated the top of my head, and I received a miracle healing. And it took a matter of minutes, and the tumor vanished. I have no scar tissue. I had another baby. And since then...
What a beautiful story.
But
the power of forgiveness, this is what I tell everyone. Right. It's amazing.
Right.
Yes.
And how great for you to be with your friend last night at the hospital.
Yes.
So important to reach out to people. So since that tumor healing happened, I have had some experiences where I've been able to also help facilitate other miracle healings. And getting to know the brain as well as I did, I decided to branch off and do a specialty called craniopathy.
Wonderful.
And that's what got us here.
Yes.
So we were talking about head trauma, and head trauma doesn't necessarily have to be a concussion. It doesn't have to be something that knocks you out. A simple bonk to the head. And when I ask the initial questions to my clients, there's a question on the front page that says, please tell me about when you hit your head. And I will tell you, more often than not, people are like, I never hit my head. And I'm like, never? Ever? Really? And they'll say, well, no, but boy, I've been dealing with depression for years. Well, how long? Oh, 2.5 years ago. Like, isn't that interesting? Back in our history, we were talking about how you hit your head onto the kitchen cupboard door 2.5 years ago.
Yes. 2.5. Just follow the pattern.
And all of a sudden they're like, oh, I get it. Now I get it. Okay, so yeah, I guess there was this, and I fell off a horse, and all of a sudden people will remember things. I had one person, she was 72 years old, and as I'm questioning her, I'm like, it really seems like you've had significant head trauma.
Right.
And she said, no. I said, are you sure? I'm pretty perceptive with these things.
Yeah.
No. And she goes, well, wait, no, I did fall off the top of a Ferris wheel, and I landed on my forehead when I was 12. But that was 60 years ago. And I said,
60
same
years ago.
brain.
Same
brain.
Nothing changed.
So
except,
these little hits can cause a tremendous amount of
trauma,
dysfunction of the brain, and causing things like sleeplessness, brain fog, things like that. So I brought a model of a skull.
And that's when we don't need to have more psych meds.
Right.
And that's what they'll do. They said, oh, all these things that happen to you, instead of, I worked hospitals, instead of getting that type of a history to find out what happened in the past, they want to prescribe more medication for you, which, you need to be worked up properly to find out what's going on. And a lot of people say, what do you mean worked up? by a person who is conscious enough and think outside the box and practice integrative or complementary medicine,
Right.
Which we both do,
Right.
which is really important. So you brought a brain.
I brought a skull. I brought a model
skull.
of I brought my brain.
Not the brain, but the skull.
This one does not have a brain. Okay, this is a model of a skull. And I brought it because I wanted you to see all the different colors. So each of these bones of the skull, there's 8 of them, all have joints that go together. So you'll see that there's lines right here. There's joints in the back of the eyes. Very common issue. There's joints in the roof of the mouth here. And
Now, if you tilt that a little bit so they can see that mouth is open, not going to bite her fingers, but the mouth is open and she's feeling the roof of the mouth,
Yep,
which is really important.
right inside here.
Yeah. Okay.
So there's 2 joints right there. Those translate all the way up to the top of the head. And what we find with, if these joints are not moving, especially up in here, we have things like anxiety, depression, and things like that. So in craniopathy, what people like me are trained to do is assess how these bones are moving. So as you breathe, these bones should expand. You breathe in, you breathe out. You breathe in, you breathe out. And this is happening all the time. Every time you breathe, this is supposed to be coming up, coming out. And the reason that we have this movement is there's cerebrospinal fluid around the brain. That's what brings the nutrients, the oxygen, brings the waste away from the brain.
Exactly.
And so we have to have this pumping movement. And so what I do is I analyze how these are moving. And sometimes I have to put a glove on and actually work inside the roof of the mouth. It's a very, very simple adjustment. One that I think should be maintained probably monthly for people because there's little things that are happening all the time.
Not to cut you off, but is this a technique that a person could kind of check themselves?
You could.
I mean, just for our listening audience right now, so they can
Right.
say, you know what, I need further testing. If it's something that they, how far the roof of the mouth would they have to, and what are they feeling for?
One way to test if your system's working properly, that's a really easy way, is to just put your hands down at your side and close your eyes. Okay, as you're standing.
And
if
you're just standing.
You're doing it standing. I'm going to sit here. But you're doing it standing with your eyes closed. And if you start going front to back, that means these aren't working right. Okay? So the brain knows it needs to get
balance.
It needs to get the cerebrospinal fluid around the brain, so it's getting the oxygen, so it's getting the nutrients, and it will do it with posture if there's an issue happening up here. There's another simple way.
I like that. So people remember that, remember that technique.
Yeah.
And doing a neurological examination when I was in training, that was one of our tests too.
Yeah.
To see if the body would sway
Right.
and which way it would go, and then put the hands out to the side of the body as well. So yeah, that's really
that's
very
a
good.
simple
And
self-assessment.
you can test this on yourself because you're going to feel.
Sure.
You can feel yourself swaying.
Right.
No one else have to do it for you.
Right.
Yes.
Right. The other interesting ways, and I see this really, really often, is I'll have somebody, I think I showed you this, where I have somebody hold their arms up, lying down, but I'm going to be doing it sitting here.
So they're lying on their back.
So they're lying on their back, they put their arms up, and I test their strength by pushing down, just have them hold their arms strong. And then I'll ask them to turn their head one way and their feet the other way. And if their brain is working right, that'll stay strong. If I have them turn their head the other way and their feet the other direction and they go weak, then we know that there's an issue with cranial torsion, which happens up here in the roof of the mouth again. And it's a very simple fix. It's painless. I have them place their arms and legs in a certain position, and I put a gloved finger on, and I go in here and I have them breathe in, breathe out, breathe in, breathe out. And
are you doing a maneuver or a massage inside the roof of the mouth when they're doing the breathing?
They're doing the breathing, and I'm doing a maneuver, basically making like a U-shaped correction.
Good. Okay.
And then you test them afterwards, put their arms up strong, have them turn head one way, feet the other way, head the other way, feet the other way, and you can tell by their arm strength. Usually they're kind of like, what? What did you just do? Because it doesn't feel like I did a lot, but it's very specialized training, and it makes all the difference in the world. And when you find somebody that has cranial torsion and you start explaining to them, like, oh, think about this. If you turn your head to the left and your brain function is slow, which means your reflexes are slow, you're more likely to be injured or strain a muscle with your head turned to the left, because think about it, your brain's not connecting as efficiently
Exactly.
with it turned to the left. But now you get it corrected, and all of a sudden things start to work right. And I thought it was really interesting. I was looking at the AARP. That dates me. I was looking at the AARP
Why
magazine.
did you tell people what the AARP
AARP is a it's a bulletin that's sent out for the Association of Retired People. I'm far from that.
Well, maybe that's why I didn't know about it. No, I'm just kidding.
We're young at heart, young in mind. But I thought this was interesting because I've been talking about this for years. I mean, I've been doing this for 20 years. And all of a sudden the AARP came out with this great thing to say, guess what? There's this function that the body has to go through to cleanse your brain. Yes. And what we have found is, if you think about it, the brain uses about 25% of our energy during the day. That's a lot. And anything
25%? Now listen to this.
Anything that's producing energy is going to have waste products as a result of it. So we have to have a way to remove those waste products.
Exactly.
One is this movement. The other is with sleeping.
And the movement with the breathing.
With the breathing.
So people should do really good deep breathing exercises throughout the day. And most people do not breathe properly.
No.
In through your nose.
Right.
Take your time out through the mouth. And I tell you this because a lot of people are watching the show, they're at work. This is something you can sit at your seat at work and do while you're driving. Just do this often. Get yourself in the mind of doing this often, and you'll feel so much better right away.
Right.
That's why I'm not exhausted for being up almost all night, because even though I didn't sleep long hours, there's other things that I did too.
Right.
For the brain.
Exactly.
And exercises. So
well, and one thing, I mean, this
really
society,
important.
we know anxiety is rampant.
Oh, yes.
It's probably one of the highest things that people are dealing with now.
Yeah.
And there is a way with breathing, I just thought of that, that you can kind of quiet yourself down and bring the parasympathetic,
lower your blood pressure, which is amazing.
All you have to do is breathe out slowly.
They even have come out with equipment that you could place on your body, and as you're breathing, it plays music.
Oh,
and if you're breathing incorrectly, you don't get the right tune. I thought that was so clever. I wish I had invented that. Yeah.
That is interesting.
So I have a lot of my hypertensive patients who said, I can't breathe. I don't breathe right. I forget to breathe. I'm like, how could you're still alive? But I have them buy the device, and now they're breathing because they can hear the sound. They can hear, other than the breath sound, they hear the music.
It's fascinating.
Yeah, it's really nice.
Yeah, breathing is such a simple thing. And let's say you're in a stressful meeting, and you're trying not to be nervous. All you have to do is just breathe out slowly. Breathe in normally, breathe out slowly, maybe for a count of 8. Nobody in the meeting is going to realize you're nervous.
I do that when I have speaking engagements. Say, everybody stand up. So by the time I get them stand up and breathing, I said, breathe with me, and I have them do a little emphatic kind of little something that I show, and then I'm relaxed myself. So you who are listening, and I've been at your function, you know why I do that now. So that we can all, so definitely I could be more relaxed. But that is
very important. So back to this AARP, so that was interesting. What they found is when people don't sleep, here we go again, with sleeping well, the brain's not getting rid of the waste matter the way that it should. And when we sleep, there's these muscles called glial cells that surround the neurons of the brain. And when we sleep, they actually diminish in size. So you have about 60% the size. You have a lot more room in the brain for that cerebral spinal fluid to flow, and for they call it the lymphatic system, to remove the waste out of the brain.
Exactly.
And one thing I wanted everybody to remember was the best way to clean your brain, if you want to call it that, is to sleep fetal position on your left side. The venous return is mostly on the right side. If you sleep on your right side, you tend to compress that. And so if you can at least start to sleep on your left side so that the brain can get that waste matter out of there, you'll be a lot sparklier.
Yes, and I had
less brain fog.
Yeah, studied some information on that a while back. Detoxing the brain a little bit there and sleeping on the left side. That spinal fluid is so much better. So, make a note of that and do this with your children, especially if you have children. Have them start sleeping if they can. Some people, I know my daughter likes to put a pillow behind her back so she can kind of stay in that position sometimes. She did that a lot when she was pregnant. and stayed on it. Those nice big large pillows. So she stayed on her left side. So keeping that in mind, that is really valuable information as far as the brain is concerned and the cerebral spinal fluid to really sleep that way. It makes a difference because I sleep that way.
Right.
It just feels good.
I just had a thought of a memory from probably 17 years ago of a baby that came in that was 4 months old, and she had never slept more than 15 minutes. Can you imagine what her family was like? 15 minutes at a time. And that's something that I think a lot of people would be good to know about this. If you see a baby, like when I looked at this little girl, her eyes were really unlevel. So if you look at the eyes, one eye on her was kind of down just a little bit, and her nose was off just a little bit. She had a very fast birth, and when a baby is born, their cranial bones squeeze together so that they can be born vaginally. And this baby was born so fast that her cranial system just didn't get balanced properly. And so this family brought her into me, and one adjustment, they called me 4 hours later, and they're like, she's still sleeping. Is that okay? And I said, of course. Poor child's tired. Yeah, let her sleep. And she's perfectly functioning, happy, normal, sleeping well teenager now.
Wonderful.
Yeah.
That's really great. Now that I'm going to have my number 10th grandchild, I'm going to make sure that we bring her to you.
Okay.
Or you will take you to her.
Okay.
Okay. So definitely check that out. Yeah, because so that's a vaginal birth. And
now we got to go C-sections.
Yes.
C-sections, a lot of people think those are a much kinder birth.
Yes. Mm-hmm.
They are very difficult on a baby's head. The babies need that compression of the skull in order to get the proper movement of the skeletal bone or skull bones to move the way that they should be. Any baby that's born C-section should have their cranium checked. Absolutely, positively have them checked.
Yes. So those who are listening who have children or grandchildren, and you don't have to, they don't have to be a baby to do this.
Right.
You need to be checked, period.
Absolutely.
Even if you're a teenager now and even older, I would say have it checked. I think this is part of a preventative way of assessment that everybody should have. We're going to do a workshop together.
Okay.
And we're going to bring in people just to do this quickly and go over some things because of the fact that we have so many symptoms and problems that we don't know where did this come from. I have a friend who constantly has, she thinks it's fluid, maybe, you never know, cerebral spinal fluid draining from her nostrils every time she leans forward. She said something is just always draining, only when I lean forward. But she did have some head trauma. Yeah. So she's watching the show. Hi. Not going to say your name. But now there's help. There is help. So I want to say that, all these wonderful tips, I'm going to let you go on because I know there's so much more. So we covered depression and stress. And when we talk about stress, too, I always throw this in about your cortisol level to make sure that you know what your serum cortisol level is. You can do a saliva or serum. Quickly, you can go to Life Extension, which I always say, and order your own lab work and do a 24-hour cortisol level just to see where you are, because we are living in a very stressful, cesspool here. I mean, it's just sad what's happening with us today. And don't watch the news; you'll be even more stressful. But you got to know kind of what's going on around you. You got to know what's going on around you here. You really have to know, but not to stay in front of the TV 24/7. Some people see the 4 o'clock, 5 o'clock, CNN. Well, we'll mention stations all day. So anyway, don't do that to yourself because that's a good way to put yourself in a really bad, stressful mood unless you're going to leave there and go see a funny movie and get some laughter going on to release those wonderful healing endorphins. So let's move on.
Let's move on. One of the things I thought back in this AARP magazine that was interesting was they're realizing with having this waste product that needs to be removed from the brain, if it's not happening properly, they're absolutely sure that there's potentially degenerative diseases like Alzheimer's that can be associated with that. So basic brain health, sleeping well, breathing right, making sure your skull is moving the way that it should. should be good to go.
Right. I have a really long checkoff list as it relates to sleep pattern and sleep hygiene. We're actually going to have another show, I will, on sleep and sleep pattern. So the positioning that you're sleeping in is now you're bringing to the table, which is really important for detoxing the brain. And really keep this in mind. Please share this show with your friends and family, because each one teach one, so that we can stay happier and healthier. So I'm going to let you go ahead and...
So another thing that we need to talk about is concussions. I mean, that's a hot topic right now.
Yes, it is.
And we were talking about minor head trauma, but when somebody has had a concussion or thinks that they may have had a concussion, the best thing that you can do is go into a dark room. No TV, no lights, no gaming, no phone.
Please don't take the cell phone in there.
No. And I know I had a very, very bad skull fracture and a concussion several years ago, so I know what it feels like. It is scary. You really do not feel like yourself. Yeah. And your thought patterns will be kind of off. And so what I'd learned, thank God for my education, was go in a dark room, lay down, put it, if you had a really significant bonk like I did, put ice on it. Have things readily available in your home, like fish oil, a good quality fish oil. That's important. I don't think a lot of people realize some of the fish oil that's out there is pretty toxic, because
it's very toxic.
Some of the companies use solvents to actually pull more oil out of the fish. And the easy way that you can check that, write this down, is open a capsule of fish oil into a styrofoam cup, and if it dissolves the styrofoam cup, throw it in the garbage. Not the cup. You can do that too, but
Great
throw
tip.
all that fish oil out in the garbage.
Great tip.
Get a good quality fish oil. It's great for anti-inflammatories, and good to eat eggs, high protein sources. So I'm looking for things that you have around your house that are
you can do something
easily
quickly.
accessible, because the last thing I wanted to do was get in my car and drive somewhere.
Yeah.
You read about choline and stuff like that. Can you imagine going into a store with a
you
shopping list and going,
and
can
you
find
want
this
to
for
really,
me?
if you have a head trauma, you want to really watch your symptoms too. If you're starting to experience double vision, if the head is really pounding, or if you feel something like coldness in that area, all the tips that you just gave is absolutely wonderful. But if the symptoms are a little severe, I suggest you call 911.
Absolutely.
Because you don't want to go lie down and slip away into a coma. That would be the worst thing. Or if you start feeling nauseous and start vomiting, and if the vomit, just shoots out of your mouth with your child or yourself, and that's more projectile vomiting, you want to make sure that you get to a hospital right away. Right. There is some signs you can test for your children. We're not going to get into that because it's a neurological sign, to see if there's a brain tumor as well, by taking an object and rubbing it along the sides of the feet to see which way the toes go. Right. So if the toes flare out or if they go down, it tells you something too. But don't try to do all that. If you have head trauma and you're feeling very dizzy, the first thing you want to do is get to an ER. Right. And you might just want to call 911. Right. And so thereafter, when you go home, we can deal with the fish oil. You can deal with some other things, and nutritionally, and find out where you are nutritionally in the beginning. So I like SpectraCell, so you can test the micronutrition as well to see where you are nutritionally. And so you don't kind of guess and start taking things. You just can go ahead and do tests. Right. So there are even tests you could test your essential fatty acid. Right. So you want to know your EFA, and when you take them, you want to know, are you taking the right combination of essential fatty acids? So in NuWellness Healthcare, that's what I do. I make sure that we're not just taking supplements. We're taking the right supplements. For brain function, I don't think you can really get too much DHEA and EPA for the brain. You need that for the brain, for good brain health. Yep. And the eggs with the choline. But that's after. But if you suffer brain trauma, especially a child, get them to the hospital. Right. Right away. Because you want to rule out exactly what's going on and then go from there. Right. Yeah.
I agree. I heard a thing one time that just sat with me for probably 30 years now. If you wear out your body, where are you going to live? And I was thinking about all the work.
Oh, that's great. If you wear out your body, where are you going to live?
Right.
That's
and I think
really good.
One of the things that I think most of us would agree, the last thing we want to have happen is to lose our mind.
Yes.
It's an awful, awful thing to see
Yes.
somebody's mind go. And so many of these things that we're talking about are just simple maintenance.
Mm-hmm.
We take care of our cars. Let's take care of our bodies too.
Exactly.
Yeah.
Exactly. Number one. So, concussions. And we know what's going on in the football arena with concussions. Unfortunately, my grandson, well, it's unfortunate for me, but not for him, he plays football. And he had recently a concussion. He did not lose consciousness, but he had a concussion. He was very dizzy. He was very stunned. So I want you to show everybody the tests that you have people do if you want to rule out. I think you just went through it with the arms.
Yes.
And that's lying on your back, so that's not standing up.
Right. The standing one that's the easiest to tell is just close your eyes and just see if they're moving back and forth. You can test arm strength and have them move their eyes in different positions. Sometimes I have them lay on their back, and we'll have them tilt their head and move their legs one side, and then tilt and move it the other way, and we'll check the body strength. But overall, the main thing I do is I actually feel, like, really get on and feel what their head is doing. It's hard for people to do self-assessments.
Yeah, on that one, no.
Yeah.
They can't do the self,
Yeah.
no. Not the skull.
No. No,
No.
you can't.
Yeah. So with the skull itself, so what manipulation, I know inside the mouth, what you're going to be doing, what do you do to the skull itself?
It's just basically getting on areas that may be stuck. One of the things, there's such a common thing, people call it TMJ, which is actually temporomandibular joint. It's actually TMT,
And the
temporomandibular.
TMJ joint is right here where the two
Yep, right
bones
in the
connect, right here.
Yep.
People clench their teeth and have the problem.
Yep.
People grind their teeth and have the problem.
Right, and it's so common.
It's very, very
and
common.
that
yes.
affects this bone right here, this brown bone. So that's called your temporal bone. That bone does the same movement as the ilium bone of your pelvis, down low here. And what we've found is when people clench their teeth, they tend to have an area in their pelvis, one joint on one side or the other tends to be a little looser. And so there are ways to prevent clenching on your own, so that a lot of times will stop that behavior from happening. So what happens if it's a little bit loose in a joint down here, it translates all the way up to the skull, because
Yes.
they do work
It's
together.
all connected, yes.
They all work together. So all day long, when you're weight bearing, which includes sitting or standing, when you're weight bearing, if the brain is getting a signal from your pelvis that there's a little instability down here, and you're not necessarily going to feel pain from it, but the brain feels it. What happens is as soon as you lie down and you don't have weight on your pelvis anymore, the body's natural reaction is to tighten up here and clench the jaws and try to open up that brain. So the brain knows it needs that circulation and that movement. So it'll clench these down, push those in, and the jaw will tighten up. So here's the secret. Write this one down too, because I know everybody knows somebody that clenches their teeth when they sleep.
Yes.
There's a little spot on the bottom of the ball of your foot.
Okay.
Kind of that natural arch kind of underneath where your toes are. If you rub your feet on a ball or on a foot massager or even with your fingers before you lay down, so you have to do it before you lay down.
And just kind of massage, take your thumb and massage in that area.
Right.
Press
right.
down,
Yep.
yes.
What that will do is it'll erase that signal that has been sent up to the brain all day while you've been weight bearing. It'll erase that signal so that you don't clench your teeth. It works
Okay.
amazing.
So people who are having reflexology in their feet, they should be sleeping really good.
They should. They shouldn't be clenching their teeth anymore.
But at least this is something you can do on your own.
Right.
Yeah, and it'd be good if you take a little lavender oil as you're massaging that area and put a little lavender oil there
Right.
too for relaxation. That would be great as well.
Right.
Yeah, what a wonderful, great tip. Now, what about people who have tinnitus, ringing of the ears?
Same place.
Ringing of the ears.
That bone. This is a major bone of the skull. I also do qigong, so that helps with tinnitus as well. If these bones of the skull are not moving right, a lot of times that's when you're going to get that ringing.
It's a buzz sound ringing.
Yeah, and it's really irritating.
Yeah.
Really irritating. It's a simple cranial adjustment with breathing and helping these bones right here get moving right. What else? ADD, So common.
Well, let me go back to the other, because one thing, we do this part. With every condition, we look at every aspect. So people with ringing of the ear, we want to make sure that they're not having a diet high in aspartame or no aspartame, because aspartame is one of the causes too. And look at the emotions, as we talked about, the emotions, but definitely aspartame would definitely cause a lot of ringing of the ears. And then, move up the ladder and get your adjustment done. Because this here is so important, because there's so many people that really complain. That's one of my questions on my questionnaire.
Right.
It's pretty in-depth. People say, oh, God, I got this 17-page.
Yeah.
But it asks a lot of questions, and there's a reason for each one of those questions.
And you want to rule out pathology, obviously.
Oh, yes.
As well.
Most definitely.
Yep. So we were just touching on ADD, ADHD. And what I have found in my practice is, especially with the children, if I teach them to just put their finger in the roof of their mouth and they breathe and just kind of push up on this part of their
No, turn it to the sides, because they can see your finger. See where her finger is?
Right there.
All the way inside the mouth. And the child can do this themselves.
And
their thumb.
If they're feeling like really frantic and out of control, they can just take their thumb, and as they breathe in, just kind of push up. Breathe in and push up, and then release it and push down, or release the thumb. Breathe in, push up, breathe out, and it works really, really well for calming
About
them
how
down.
much repetition should it? About
Probably
3 or 4
3 times.
Okay, a
3
couple times a
would be
day.
Plenty. If they're feeling
There's no
really
side effects
really out
to
of
it, so
control. No, it's just getting that natural skull movement going the way
What
that it
about
should.
people who used to suck their thumb and kind of push it up there? They should not have had any problems.
They do say that's a self calming process that especially babies go through.
No, really?
If they do feel like they've need the help, that naturally calms them down. They just figure it out. Amazing,
Really?
isn't it?
Maybe that's why I was so calm. I suck mine.
Yeah. And
That's why one looks different than the other from years ago. But I was calm.
Yeah, I can tell.
Thank you.
Yeah, you're welcome. We've also had really great results with dyslexia. And that's a very frustrating learning disability for people.
Yes.
And what we have found is a lot of times it's an issue with their frontal bone. And just a simple test, again, non-invasive.
Yeah.
You're just testing their arm strength and having them move in different positions. And a lot of times you can get relief. Maybe not cure it, but at least get it so that they have a little more clarity.
Yes. And that's what we want, day by day, a better quality of life, moment by moment.
Right.
And the more you do this, the better you should heal and feel.
Right.
Yes, I would think so.
Yeah.
But those are some very good tips that you have given, some information that everyone, if you don't have this going on in your home, you know someone else that does.
Right.
Especially the relaxation, I like that. So that could be for adults as well as children. If you're feeling really stressed out, just go into another room and then place your thumb, wash your hands, place your thumb in your mouth and just press up and do the deep breathing.
Yeah.
Wonderful.
So when you breathe in.
Breathe in.
Yeah, breathe in and push up.
Breathe in and push up.
And you don't have to push very hard.
Okay.
It's just a very gentle.
I'm glad you said that. I'm glad you said that. So
people coming in going, I don't know what I did to the roof of my mouth. I didn't tell you to do it that hard.
And watch the nails. If you have sharp
Yes,
nails,
yes.
watch those nails.
Yes.
Yes.
Absolutely.
Yeah, so I want to say, make sure before you do that, make sure you do wash your hands. Very good. Because this is not just for women, it's also for men.
Right.
And children,
Yep.
male, female. So this is wonderful. So come on, you got great tips here.
Thank you. I know one of the things that you and I talked quite a bit about, and I really do want to focus on intention. Intention is such a powerful thing. And like for my own case and my own healing, my intention was there. I was not going to let them cut open my head. In my type of tumor that I had, it came back in about 80% of cases after surgery. And I had just started in practice, and I did not want to have my head opened up.
Right.
And I wanted to figure out, why did I have this? And so with intention of healing, I think a lot of people have had major successes. In fact, I just read one today that I thought was so fantastic. This couple, they ended up getting together and moving in together, and he lost 60 pounds. And they couldn't figure out why, and they found out that he had a malignant tumor. did chemo and radiation, and he didn't respond well to it. So they changed, like I did. I forgot to tell this part. I actually fasted for 10 days. I just said, I got to clean house because something's causing that tumor. But they changed to a vegan diet, and their intention was to get rid of the tumor, and it was successful.
Okay.
And so the power of the mind is very, very great.
Yes. Yes. And you brought up in the very beginning about your eyesight and not having the closure and forgiveness with your father. This is going to be very short, but I had a flat tire one day and met this wonderful mechanic. And I said, well, this whole journey was so beautiful. Met this wonderful mechanic, and he started telling me the story about his best friend who he kind of just left his wife, divorced his wife, left her, didn't know she was pregnant when he left. He remarried and had 2 kids. His friend had gone to him and said, man, you have a son. You have a son, something that I want. I have 6 girls. You have a son. And he had 2 girls by his second marriage. He said, don't you want to see your son? He wants to meet you, as he was growing up. And he said, I never want to ever see him or her, ever. And he went blind.
Wow.
Now, there's usually some medical things that, are going on too. But as soon as he said it repeatedly, I never wanted to see. And when he told me that, I said, wow, and he's blind? I said, but he said it. I never want to see. You have to be careful with words.
Right.
Words are powerful. And even getting well, I had a person who said, she had breast cancer, and I usually don't like to say the C word. I just say abnormal cells, people who know me. And it was so bad that it really looked as though she should have had it removed, had a mastectomy. And she said, I came into the world in one piece. I'm not having pieces removed from my body. I'm not having my breast removed. My breast will heal. And so I sent her to someone else because it was so bad. I didn't want her to have a systemic infection. Right. And plus she wasn't keeping it clean. And that's what my fear was. You got to do everything too if you want to try to keep, And she came back to me about 6 months later, totally healed. Totally healed. But I did as much for her. But they kept saying, we don't understand why you're not real sick, why this is not happening with you, because of nutrition and everything we had already done. But her thought, I am going to keep my breasts. The same thing with my grandfather, who said, I'm going to live to be 100. He told me this since I was a little girl. And I said, okay, Granddaddy. I'm going to live to be 100. I said, okay, Granddaddy. And 2 years ago, probably about 2 years ago, in January, he turned 100.
Wow.
And so the next day he stopped eating. So I said, well, Granddaddy, you're not leaving us yet. And so he lived for about 8 months longer. And then he said, I'm ready to go. I'm ready to go. I live past my 100. Wow. And so the intent, we have to be careful. So my intent was to never grow old, looking wiser, never have menopause, which I never have. And so those were some of my things. I said, that is not mine. Menopause is not my friend. Now, I watch hormone levels and do all that, but I'm not having these symptoms people have, the hot flashes, the this, the that, the moose. I'm not having that, and I never did. So the things we tell ourselves is what we become.
That reminded me of when I was doing my Qigong training with Dr. Effie Chow. We were talking about the power of words.
Yes.
And we were on a news segment one time, and the anchors were just bantering back and forth. And she's like, well, he's like the little brother that I never wanted. And she's just like, whoa, you can't talk like that. You've got to be careful. You need to lift each other up. I mean, people are starting their day by watching you. And they're like, what are you talking about? And so she gave this demonstration. And she said she had them hold their arms strong. And again, that's another good way to monitor.
Well, she said hold your arms strong. You just hold it straight out.
Yeah, you hold it straight out like this.
Yeah, straight out, strong.
And she would test their strength. And she'd say something nice about him. And this anchor was like, I can't think of anything. And she said, say you like his tie, but mean it. And so she's like, oh, I like your tie, and it was strong. She goes, now say something else. And she's like, you're just such a dork or something like that. And she couldn't hold her arm strong. So we started talking about words and the importance of them. And when you use the word just, everybody uses the word just, like Nike, just do it. Just absolutely takes our energy away. Test on your friends. Have them hold out their arm. Say, do it. Test their arm strength. Then have them say, just do it. And they will lose their strength in their arms. So the power of words are really, really important of what you put out there to people. So sorry, Nike. You might want to get a new logo.
Yeah, just do it. Do not use the word just.
Yeah. Or I'll try.
I try.
We know try will never work.
No. I like what Les Brown, very dear friend, he says, try to sit down in a chair. Try to sit down in a chair. You either sit down or you don't.
Right.
Yeah, just try. Yeah, so you either do or don't. I try to remove that from my vocabulary.
It can be hard.
It is hard because every time I say the word, I say, oh, you know what? I don't know if I'm going to be able to make it, but I will call you if I can.
Mm-hmm. Perfect.
So we start, finding another way to say it so you don't say I try. Because usually when you say I try, you don't go anyway.
Right.
You don't make it.
I will do it.
I will do it.
Feels good, doesn't it?
Yeah, I will do it. Then you got to work hard and be committed and do it.
Exactly. But then
Yes.
you feel good about yourself.
Yeah, definitely.
You took care of it.
Mm-hmm. So that was really good. I love that. So we have covered so much now. We have a few more minutes left. And in just a couple of minutes, what do you want my listening audience to take away from? I want you to look into the camera like you're looking into their eyes. And what do you want to tell them, each person?
I want you to believe in your body and your mind. I want you to know that the health is within. You have the power to do whatever it is that you feel you want to be successful. All of us were created with this ability to heal. And it's all in our mind. We can take care of it, think through it clearly, know that we own this, because we are very powerful. And if you wear out your body, where are you going to live?
I love that.
Isn't that great?
That is. That is. I want to thank you for that. And I want to thank you so much for being here today.
Thank you.
You're just absolutely amazing. And I just love your spirit. It's just wonderful. It's just something about today and right now, I feel full. But it's full of joy. It's full of joy. Yeah. So people I know saw me wipe away a little tear. But it's full of joy. It's just something wonderful I feel is about to happen. Take this information in. Share it with your friends and family because it's something that could save your life or your family's life. And these are simple procedures.
Yeah.
And we are going to put up your website.
Okay.
Or better yet, he has your website already up. So thank you so much, Jarvis, over there. Thank you.
And
thank
I do love working with challenging cases. Those people.
You sound like me because I didn't leave work to 10:30 because of some challenging cases. Yeah. You and I have so much in common.
I know.
But I'm not a chiropractor, so I don't do what you do. But it's amazing in my CRT test, which is FDA approved for breast screening. There's an axle component, and people with TMJ, migraine headaches, one leg shorter than the other. All this stuff comes up in their report. So I was asked, are you having headaches? Yes. Well, then I don't do that part. So they will be coming to you.
Yay.
Yeah, they'll be coming to you for all of the migraine headaches and all these other things.
And general maintenance.
Yeah. And, and I have to tell people, when you're on a weight reduction program, not weight loss, because I'm not trying to find your weight, okay? When you're on a weight reduction program, more so a lifestyle change, your body should be adjusted after, because things shift after you gain or lose. Right. Things will shift. So you should definitely always have an adjustment done after losing weight, because that pull from the weight on the hips and on those muscles and on your spine, it's totally has shift. So we're going to be doing a lot of business together. Yeah, because you do things I don't do and vice versa. So I'm just really thankful for you being here today.
Thank you.
And I want each one, there's so much going on right now. Please, please take time to love yourself. Please take time to pamper yourself. Please, if you even do your own foot massage, get yourself some lavender. Take time for you. Take time to do your deep breathing exercises. Take time to call someone else and tell them I love you, because you might not have that opportunity to pick up that phone to make that call again. So when someone is on your mind, take time to call them if you have a chance. I don't have time to talk. Just call to say I'm thinking about you and I love you. There's a reason I'm saying this today. So for those who are listening, please take time to do that. I want to thank everyone for tuning in today to the NuWellness TV with Dr. Lee. I have something very exciting for you for 2018. We're adding another component to this show that's going to be hot. So everybody's going to tune in and get well and be happy through this wonderful journey in life. And again, I always say something, and I have everybody to repeat after me. But before I say that, I want to say that your brain and your thoughts are so powerful. So keep in mind, keep those thoughts clean. And whatever you want to happen in your life, envision that. You know, people are doing vision boards and different things, but envision yourself doing wonderful, great things. Don't see the negative all the time in people and in yourself. See the positive and watch how it shows up for you. That's my friend Robbie Motter. Watch how it shows up for you. So I want to say, take care of yourself. Now, repeat after me. I am.
I am.
So grateful.
So grateful.
That I am.
That I am.
A magnet.
A magnet.
For miracle.
For miracles.
Hug yourself. Hug someone else. Have a blessed day. Thank you.
It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.